If you're over 60 and thinking about Ozempic, there's one risk almost nobody explains before your first shot. It's not nausea. It's not the price. It's what this drug can quietly take from your body, and it's hard to get back.
In this video, we're looking at what recent research says about Ozempic after 60. We'll cover the muscle risk and the bone risk, and we'll explain why and at the end, the exact questions to bring to your next doctor's appointment. Let's get into it.
Ozempic and Wegovy work. People lose real weight. But here's what most people over 60 don't realize. Up to 40% of the weight lost on these drugs isn't fat, it's muscle. For someone in their 30s, losing some muscle with the fat is manageable. Their body bounces back fast. But after 60, it's a different story. This muscle loss already has a name: sarcopenia. It affects about 1 in 3 adults over 60. It's one of the biggest reasons seniors fall, break a hip, and lose their independence. Ozempic doesn't cause sarcopenia, but it can speed it up if you're not protecting your muscle while the weight comes off. That's the biggest mistake I see. People watch the number on the scale and forget to ask what kind of weight they're losing. So what can you do about it? We'll get to the plan. First, a second risk that matters just as much. Muscle isn't the only thing at risk. Doctors are also watching bone density closely. Rapid weight loss on these drugs can lower bone density, and that stacks right on top of the fracture risk you already have after 60.
If you already have osteopenia or osteoporosis, this is a conversation to have before you start, not after. Here's what doctors are now recommending: a baseline DEXA scan before starting, and a follow-up scan after 12 months.
If your doctor hasn't brought this up yet, you bring it up.
Most people don't realize a 5-minute scan could change how their whole treatment plan is managed.
Now, the reason your body reacts to all of this differently than a younger person's, that's next.
Age changes how your body processes this medication. And that matters more than most people think. Semaglutide is cleared through your kidneys and liver. As we age, both slow down.
That means the drug can stay in an older body longer than in a younger one, at the exact same dose. That's exactly why doctors are recommending a much slower start for seniors. Instead of the standard 4-week ramp-up, many are moving to 16 to 20 weeks, low and slow. This also explains something else. In clinical trials, adults 65 and older had more nausea and vomiting than younger patients.
They were also more likely to stop the medication altogether because of it. Here's the reframe. Your body isn't broken. It's just processing this differently than a 35-year-old's would. That's the whole reason this conversation with your doctor matters more than a quick prescription refill. Next, 2 new pieces of research worth knowing before your next appointment.
First, a fitness tracker study, presented at a major endocrinology conference this year, found something surprising.
People on these medications walked about 560 fewer steps a day after starting, compared to before.
Less movement plus muscle loss. That combination is exactly what doctors are watching most closely. Second, the rare but serious risks. These are uncommon, but worth knowing.
Kidney injury, severe allergic reactions, and pancreatitis have all been reported, at any age, not just after 60. These are uncommon, but they're exactly why any new symptom deserves a phone call to your doctor, not a wait and see. None of this means Ozempic is off limits after 60.
For the right person, it can meaningfully lower cardiovascular risk. Now, let's talk about doing this the right way.
Medicare now covers semaglutide for people with obesity and a history of heart attack, stroke, or artery disease, not just diabetes. So this isn't about avoiding the medication. It's about doing it the right way after 60.
Step 1. Get a baseline DEXA scan before you start. Repeat it at 12 months.
Step 2. Push your protein intake and add resistance training. This one is non-negotiable for protecting muscle. Step 3. Ask your doctor about a slower dose schedule made for your age. Step 4. Track any new foot pain, swelling, or stomach symptoms, and report them early, not later.
4 steps. That's it. That's the difference between doing this safely and doing it blind.
Print these out. Bring them to your next appointment. Your doctor will be glad you did. That's the plan. Now let's bring it all together. Here's what matters most. The biggest risk isn't the drug itself. It's starting without a plan for your muscle and your bones.
Do that, and this can be a genuinely safe, effective tool after 60.
If this helped you understand what to ask your doctor, hit subscribe. Every week, I break down what's actually happening in senior health, not the rushed version from a 7-minute appointment. Are you or is a parent on Ozempic? Drop a comment. I read every one.
And if you want the full plan for protecting muscle as you age, watch this video next.
Thanks for spending this time with me. Take care of yourself out there.